Let me ask you something. Are you waking up 2, 3, 4 times a night to urinate? Is your stream weaker than it used to be? Do you feel like your bladder never fully empties? Are you rushing to the bathroom with urgency that wasn't there 5 years ago? If any of those describe your daily life, you already know what an enlarged prostate feels like from the inside. What you may not know is exactly how much can be done about it and how many different ways there are to do it. There are 4 procedures that urologists use to address enlarged prostate symptoms when medication isn't enough or isn't the right fit. They range from an in-office procedure that takes about 5 minutes to a more involved surgical approach that's been the gold standard for decades. Each one works differently. Each one is right for a different situation. Today, we're comparing all 4 clearly, honestly, and in plain language. Quick but important. Everything here is educational only, not medical advice. Enlarged prostate management requires individualized evaluation by a qualified urologist. Never make treatment decisions based on this video alone. Drop prostate in the comments for a free comparison guide. All 4 procedures side by side with the questions to bring to your urologist. Before the comparison, one thing worth understanding clearly, because it changes how you evaluate every procedure on this list. An enlarged prostate, the medical term is benign prostatic hyperplasia, or BPH, is not cancer. It has no relationship to prostate cancer. It is simply the prostate gland growing larger with age, which happens to the majority of men and which causes symptoms by compressing the urethra, the tube that carries urine through the prostate and out of the body. The goal of every procedure on this list is the same: reduce the obstruction, restore better urinary flow, improve quality of life. None of them are cancer treatments. All of them address a mechanical problem: too much prostate tissue pressing on a tube that needs to stay open. With that context, the comparison makes sense, because each procedure addresses that mechanical problem in a completely different way. Procedure 1. UroLift, the mechanical implant approach. UroLift is the newest of the 4 procedures and the one that generates the most questions, partly because it's been heavily advertised directly to patients, and partly because what it does is genuinely different from anything that came before it. Here's the mechanism. UroLift does not remove prostate tissue. It does not heat it, ablate it, or vaporize it. Instead, small permanent implants, tiny devices about the size of a staple, are placed through a scope into the urethra and used to pull the enlarged prostate lobes apart and hold them open, like pulling curtains away from a window. The urethra stays open because the tissue blocking it has been physically moved to the sides rather than removed. The procedure is typically performed under local anesthesia in an office or outpatient setting. It takes approximately 1 hour. Most men go home the same day and return to normal activities within a few days. There is no incision. What makes UroLift particularly relevant for men over 60 is its side effect profile, specifically what it doesn't do. UroLift is the only procedure among the 4 that has a documented low rate of retrograde ejaculation, a side effect in which ejaculation goes backward into the bladder rather than forward, which is common with other BPH procedures and which affects sexual function and fertility. For men who consider this an important quality of life factor, UroLift's profile is meaningfully different from the other 3. Who is the best candidate for UroLift? Men with moderate BPH symptoms, a prostate that is enlarged but not extremely large, generally under 80 grams, and no significant middle lobe enlargement. The middle lobe is the portion of the prostate that grows toward the bladder rather than to the sides. UroLift is less effective when middle lobe enlargement is the primary obstruction. The honest trade-off: UroLift's symptom improvement, while meaningful, tends to be somewhat less dramatic than the tissue-removing procedures we'll cover shortly. And because the implants are permanent, any future procedure that requires passing instruments through the urethra, including a future BPH procedure if symptoms progress, needs to account for their presence. Durability. 5-year data shows that approximately 80% of men who had UroLift did not require retreatment within that window. That's a strong result, but lower than the long-term durability of TURP, which we'll cover last. Procedure 2, Rezum, the water vapor therapy approach. Rezum is a procedure that uses steam, water vapor heated to approximately 103 degrees Celsius, delivered in precise bursts directly into the prostate tissue through a small needle inserted via a scope through the urethra. Here's the mechanism. Each burst of steam lasts approximately 9 seconds. During that 9 seconds, the thermal energy carried by the steam transfers into the surrounding prostate cells and destroys them. The body then absorbs the dead tissue over the following weeks, gradually reducing the size of the prostate and the obstruction it creates. The full effect of the procedure isn't felt immediately. It builds over 6 to 12 weeks as the treated tissue is reabsorbed. The procedure is typically performed in an office or outpatient setting under local anesthesia with sedation. It takes approximately 1 hour. Most men go home the same day. What makes Rezum relevant is its combination of meaningful symptom improvement with a relatively low side effect profile. Like UroLift, Rezum has a significantly lower rate of retrograde ejaculation than TURP, though higher than UroLift. And because it reduces prostate volume rather than mechanically repositioning tissue, its effects can be more durable for men with moderate to larger prostates than UroLift. Who is the best candidate for Rezum? Men with BPH symptoms that haven't responded adequately to medication, a prostate in the moderate to moderately large range, roughly 30 to 80 grams, and who want to avoid the longer recovery associated with surgical procedures. Rezum is also one of the procedures that can address middle lobe enlargement, an advantage over UroLift. The honest trade-off: the gradual onset of benefit is both a characteristic and a limitation. Men who need rapid symptom relief, particularly those with significant urinary retention, may find the 6 to 12-week improvement timeline frustrating. Additionally, most men require a urinary catheter for a period after the procedure, typically 3 to 5 days, while the initial post-treatment swelling resolves. Durability: 4-year data shows approximately 82% of men did not require retreatment. Longer-term data beyond 5 years is still accumulating given the procedure's relatively recent introduction. Procedure 3, laser procedures, GreenLight PVP and HoLEP. This category includes 2 distinct laser-based approaches that share a mechanism, using laser energy to remove or vaporize prostate tissue, but differ significantly in how they do it and which patients they're best suited for. GreenLight PVP, photoselective vaporization of the prostate. GreenLight uses a high-powered laser delivered through a scope into the urethra to vaporize prostate tissue directly, turning it into vapor and steam rather than cutting it away. The tissue is eliminated in real time during the procedure rather than being removed as specimens. It is typically performed under general or spinal anesthesia in a hospital or surgical center. Procedure time ranges from 30 minutes to over an hour, depending on prostate size. Most men go home the same day or the following morning. GreenLight's primary advantage is its safety profile in men who are on blood-thinning medications, anticoagulants like warfarin, apixaban, or rivaroxaban. The laser's coagulating effect provides excellent control of bleeding during the procedure, making it one of the preferred options for men whose cardiovascular conditions require ongoing anticoagulation that can't be safely interrupted for surgery. Who is the best candidate for GreenLight? Men with moderate to large prostates, men on anticoagulant medications, and men for whom the bleeding risks of traditional surgery are elevated. It is also appropriate for men who want more significant symptom improvement than the in-office procedures typically provide. The honest trade-off: retrograde ejaculation rates with GreenLight are higher than with UroLift or Rezum, similar to traditional TURP in some studies. And because the vaporized tissue is not preserved for pathological examination, GreenLight cannot provide tissue specimens for prostate cancer analysis, a consideration for men with any elevated PSA concerns. HoLEP, holmium laser enucleation of the prostate. HoLEP is technically more complex than GreenLight and requires a surgeon with specific training, which means it is not available at every urology practice. But for men with very large prostates, it represents one of the most effective procedures available. Where GreenLight vaporizes tissue, HoLEP enucleates it, essentially separating the enlarged inner prostate from its outer capsule in large pieces, which are then morcellated, mechanically ground, inside the bladder and removed. The result is a very thorough removal of obstructing tissue with excellent long-term durability. Who is the best candidate for HoLEP? Men with very large prostates, typically over 80 to 100 grams, who would otherwise require open surgery. HoLEP achieves outcomes comparable to open prostatectomy without the large abdominal incision, making it the preferred approach for very large glands at centers where the expertise exists. The honest trade-off. The procedure requires general or spinal anesthesia, a hospital stay of 1 to 2 days, and a catheter for approximately 1 to 2 days afterward. The learning curve for surgeons is significant. Outcomes depend substantially on surgical experience with the technique. Procedure 4. TURP, transurethral resection of the prostate. TURP has been the gold standard for surgical BPH treatment for over 60 years. Every other procedure on this list is compared against it in clinical research. Understanding TURP is essential for evaluating everything else. Here's the mechanism. A resectoscope, a specialized instrument with a wire loop, is passed through the urethra to the level of the prostate. The wire loop uses electrical current to cut away small chips of prostate tissue in a systematic pattern, widening the urethral channel. The tissue chips are irrigated out and collected for pathological examination. The result is a significantly widened channel through the prostate that allows substantially improved urinary flow. TURP is performed under general or spinal anesthesia in a hospital or surgical center. Procedure time is typically 45 minutes to 90 minutes. Most men stay in the hospital for 1 to 2 days. A urinary catheter remains in place for approximately 2 to 3 days after the procedure. What makes TURP the standard is its durability. 15 and 20-year follow-up data consistently shows that TURP provides the most durable long-term symptom relief of any BPH procedures, with retreatment rates significantly lower than the newer minimally invasive options over extended timeframes. For men who want to address the problem once and have it remain addressed for the rest of their life, TURP has the strongest long-term evidence base. Who is the best candidate for TURP? Men with moderate to large prostates, generally 30 to 80 grams, significant symptom burden that hasn't responded to other approaches, and who are appropriate candidates for general or spinal anesthesia. TURP is also the procedure most likely to be covered by insurance and available at virtually any urology practice. The honest trade-offs. TURP has the highest rate of retrograde ejaculation of the 4 procedures, affecting approximately 65 to 90% of men who undergo it. This is the most important side effect consideration for men who value preserved ejaculatory function. TURP also carries a small risk of urinary incontinence, typically temporary CHO, and a small risk of urethral stricture formation over time. Recovery is longer than the minimally invasive procedures. Most men experience several weeks of urinary irritation, frequency, urgency, occasional discomfort during the healing period. Full recovery typically takes 4 to 6 weeks. The honest side-by-side comparison. Now that we've covered each procedure individually, here's how they compare across the factors that matter most for men making this decision. Symptom improvement. All 4 procedures improve BPH symptoms significantly compared to no treatment. In head-to-head comparisons, TURP and HoLEP tend to produce the most dramatic symptom score improvements. GreenLight produces comparable results. UroLift and Rezum produce meaningful improvement that is somewhat more modest on average, though individual results vary considerably. Recovery time, UroLift and Rezum, days to 1 week for most men. GreenLight, 1 to 2 weeks. TURP, 4 to 6 weeks. HoLEP, 1 to 2 weeks for most men. Retrograde ejaculation risk. UroLift, very low, approximately 5%. Rezum, approximately 10%. GreenLight, approximately 50 to 60%. TURP, approximately 65 to 90%. HoLEP, approximately 70 to 80%. Appropriate prostate size. UroLift, small to moderate, generally under 80 grams, no significant middle lobe. Rezum, small to moderate, 30 to 80 grams, can address middle lobe. GreenLight, moderate to large, effective across a broad size range. HoLEP, very large prostates, over 80 to 100 grams. TURP, moderate, generally best for 30 to 80 grams. Long-term durability. TURP and HoLEP have the strongest long-term data. Retreatment rates at 10 to 15 years are lower than the minimally invasive options. UroLift and Rezum have strong 5-year data, but longer-term data is still accumulating. Anesthesia requirement. UroLift and Rezum, typically local with sedation, outpatient. GreenLight, general or spinal, outpatient or one night. HoLEP, general or spinal, 1 to 2 nights. TURP, general or spinal, 1 to 2 nights. The 5 questions to bring to your urologist. Everything in this comparison becomes most useful when it informs a specific conversation. Here are the 5 questions that will make your next urology appointment significantly more productive. 1. What is my prostate size in grams, and does that affect which procedures are appropriate for me? 2. Do I have middle lobe enlargement, and if so, which procedures are appropriate given that anatomy? 3. I'm interested in understanding my options for preserving ejaculatory function. Which procedures have the lowest risk of retrograde ejaculation? And am I a candidate for them? 4. Given my overall health, my medications, particularly any anticoagulants, and my other medical conditions, which procedures are safest for me specifically? 5. What is your personal experience with each of these procedures, and which ones do you perform regularly? If there's a procedure that might be appropriate for me that you don't perform, would you be willing to refer me to a colleague who does? That last question is the most important one most men never ask. A urologist who performs primarily TURP will naturally present TURP as the primary option. A urologist who has adopted UroLift will naturally present that. The procedure you're offered first is not necessarily the procedure that's best for your specific situation. It's often the procedure your urologist does most frequently. Knowing all 4 options and asking about all 4 gives you the information to evaluate that recommendation in full context. An enlarged prostate is one of the most manageable conditions men face after 60. The symptoms that disrupt sleep, limit daily activities, and affect quality of life in ways that compound over years, they don't have to be permanent. And the range of options available today is broader, more targeted, and less disruptive than it has ever been. What turns that range of options into the right decision for any individual man is information. The kind of information that lets a patient walk into a urology appointment as an active participant rather than a passive recipient. You now have that information. Drop prostate in the comments for the free comparison guide. And if you know a man who's been putting off this conversation with his doctor because he assumed surgery was the only option, share this with him. Because sometimes the conversation that changes everything is the one that starts with knowing there are more choices than you thought. See you in the next one.